Hello guys, this is Aditi Utskare. I am going to present anti-arrhythmic drugs. First, shortly, we will discuss about arrhythmia. Then, what is arrhythmia? Arrhythmia has different names. That is cardiac arrhythmia, or it occurs in that it causes irregular heartbeat. So it is also called as heart arrhythmia. Then why this occurs? So arrhythmia occurs when the electrical impulses that coordinate heartbeat don't work properly. It causes heart to beat too fast or too slow or irregular. Then we will discuss about anti-arrhythmic drugs. What is anti-arrhythmic drugs? So it may be defined as drugs that are capable of reverting any irregular cardiac rhythm or rate to normal. Antiarrhythmic agents are also called as anti-dysrhythmic drugs or antifibrillatory drugs. In this classification of antiarrhythmic drugs, there are four types. That is, first is membrane stabilizing agent. It is also called as sodium channel blockers. Then anti-adrenergic agents, also called as beta blockers. Then potassium channel blockers and calcium channel blockers. Then we will discuss about some antiarrhythmic drugs. The first is quinidine sulfate, and that's brand name is quinaglute. Here is its structure. So in this we will discuss about mechanisms of action and its uses. So the mechanism of this is quinidine sulfate exerts its antiarrhythmic effects by depressing the flow of sodium ions into the cells during phase 0 of the cardiac action potential, thereby slowing the impulse construction through the atrioventricular node AV node, reducing the rate of phase 0 depolarization and prolonging the refractory period. So, its uses. It is used as an antiarrhythmic drug. It is used in supraventricular tachycardia and ventricular arrhythmias. The next drug is procainamide hydrochloride, and brand name is Procanbid. Mechanism of action. Procainamide is an antiarrhythmic drug. It forms complex with myocardial cell membrane, and it blocks the Na+ channel conductivity and the flow of Na+ into the cells, release of K+ from myocardial cells. This leads to weak suppression of depolarization of myocardial cell, reduction of repolarization time, and showing of the propagation of excitement. It indicates the refractory period. So, it is used in the treatment of paroxysmal tachycardia, atrial fibrillation, premature ventricular contraction, and ventricular tachycardia. Then, disopyramide phosphate, the brand name Norpace. Mechanisms of action. It targets Na+ channel to inhibit the conduction of Na+ ion. It depresses the increase in Na+ permeability of cardiac myocyte during the action potential, which causes decrease in inward Na+ current, which causes increase in threshold excitation. It prolongs the PR interval by lengthening QRS and P wave duration and slows the action potential propagation through the atria to ventricles. Uses. It is used in atrial fibrillation and ventricular arrhythmias. Next drug is phenytoin, and brand name is dilantin. Its mechanism of action. It binds to the inactive form of Na+ ion and causes voltage-dependent block of voltage-gated Na+ channel. Uses: it is used in the treatment of atrial and ventricular arrhythmias. It is also used in the treatment of epileptic seizures. Next drug is lidocaine hydrochloride and brand name is xylocaine. Mechanism: it belongs to amine-amide class of local anesthetic. It blocks the generation and conduction of nerve impulses by increasing the threshold of electrical excitation in the nerve cells by showing nerve impulse by increasing the rate of action potential. Uses: it is used in the treatment of ventricular arrhythmias. It is effective when administered parenterally. Next drug is tocanide hydrochloride and brand name is Tonocard. Mechanism: tocanide hydrochloride is the hydrochloride salt form of tocanide, a primary amine analog of lidocaine exhibiting class 1b anti-arrhythmic property. Tocanide hydrochloride stabilizes the neuronal membrane by reversibly binding to and blocking open and inactivated voltage-gated sodium channel. This inhibits the inward sodium current required for the initiation and conduction of impulses and reduces the excitability of myocardial cells. Uses: it is used in the treatment of ventricular arrhythmias. Next drug is mexiletine hydrochloride, brand name Mexilite. Mechanism: mexiletine, like lidocaine, inhibits the inward sodium current, thus reducing the rate of rise of action potential phase 0. Mexiletine decreased the effective refractory period (ERP) in Purkinje fibers. Uses: it has similar effects as lidocaine and tocanide. It is used in the prevention of ventricular arrhythmias. Next drug is lorcainide hydrochloride, brand name Remivox. Mechanism: lorcainide inhibits adenosine 5-triphosphate hydrolytic action of myocardial Na plus K plus ATPase in vitro in concentration dependent manner. Uses: it helps to restore normal heart rhythm and conduction in patients with premature ventricular contraction. Next, amiodarone, brand name Passeron. Mechanism: amiodarone is considered class 3 anti-arrhythmic drug. It blocks potassium current that causes repolarization of the heart muscle during the third phase of the cardiac action potential. As a result, amiodarone increases the duration of action potential as well as the effective refractory period for cardiac cells, that is myocytes. Uses: it is used in the treatment of control and management of ventricular and supraventricular arrhythmias. It is also used in the treatment of angina pectoris. Then the last drug is sotalol, brand name Betapase AF. Mechanism: sotalol exhibits reverse use dependent effects, meaning that the maximal potassium current blocking effect occurs when the heart rate is low. A low dose is enough to exert a beta blocking agent effect. Then uses: it is mainly used in the treating life-threatening ventricular arrhythmias. Here is the anti-arrhythmic drugs are completed. Thank you so much.